Welcome to the Nursery Policy and Procedures segment of the Safe Sanctuary Training. This presentation covers the policies and procedures for maintaining a safe, clean, and positive environment in the nursery. Let's first take a look at the opening procedures. You'll want to arrive 15 minutes prior to your scheduled shift to prepare yourself and the nursery for the day. Gather the supplies you may need for this shift, including cups, sign-in sheets, and snacks. Wipe down the counters, the high chair, and the changing table pad with a disinfecting wipe or spray. Even though this is done during cleanup, the nursery is often used during unofficial times and may not be as clean as it appears. Make sure the bathroom is tidy. Put away all the toys that have been sanitized and are laying out to dry. You'll want to note any problems with the state of the nursery in the notebook and then bring it to the attention of the nursery coordinator. And finally, greet the children and the parents as they arrive. Make sure that the parents fill out the sign-in sheet and ask if there are any allergies. Also, ask if they would like to leave a number where they can be reached if they're needed. Don't forget to place a name tag on the back of an unfamiliar child. Now let's move on to maintaining personal hygiene. Wash your hands frequently to prevent the spread of disease. When should hands be washed? At the beginning of your shift, after diapering, after using the bathroom or after helping a child use the bathroom, after wiping saliva or tears, after wiping or blowing a nose, and before or after serving food. Sanitizing is a big part of the nursery procedures, so let's talk about how to do that. In one of the white bins or other large container, make a solution of 1/4 cup bleach and 1 gallon of water. Place all non-fabric toys into the solution. Allow the toys to soak and then allow them to air dry. You'll want to sanitize toys that have been in a child's mouth, toys that have been in wet or dirty hands, toys that have come into contact with food, and any surface that may have come into contact with bodily fluid. Diapering is another important activity in the nursery. To diaper properly, diaper only on the changing table. Bring your supplies to the changing table first before you bring the child. Put on a clean pair of disposable gloves, and after putting on a fresh diaper, note the time in permanent marker on one of the front tabs of the diaper. Dispose of the dirty diaper in the garbage or put it in a Ziploc bag first if it is particularly aromatic. Use a disinfecting wipe or spray to wipe down the changing table, and remember to wash your hands afterwards. Also, be sure to keep the changing table free of personal items such as purses and other objects. Most kids enjoy having a snack in the nursery, but before serving, be sure to check for food allergies on the sign-in sheet. Always have children eat at the table or a high chair, and never let them eat while walking or crawling around. If a child has brought a snack from home, be sure to serve it first before offering Lord of Life food. Most children enjoy their time in the nursery, but occasionally behavior issues do arise. You'll want to comfort a fussy or crying child first, but contact the parent if the child continues to cry after 10 minutes. Redirecting a child's attention to a toy, book, or activity will often stop the crying. Be sure to immediately contact a parent, nursery coordinator, or other Lord of Life staff member if you need help controlling extreme behavior. Sometimes a parent may wish to speak to someone in charge. In that case, simply give them the nursery coordinator's contact information. Now let's talk about how scheduling works and phone use policies. Schedules are created monthly and are usually available mid-month. If you are unable to work your scheduled shift, it is your responsibility to find a substitute and to notify the nursery coordinator of the change. Remember, document your hours on the sign-in sheet. When it comes to phone use, the Lord of Life phone should be used only in urgent situations or to contact a parent. Staff may have their cell phone while working, but use discretion when using your phone and do not let it affect your work quality. Although we usually use only one room, the nursery actually has 2 rooms. When using both rooms, the main nursery room is for infants and the second room is for toddlers. If moving children into the second room, note the transfer on the sign-in sheet. Be sure to transfer the child's belongings, but do not transfer toys between rooms. After use, be sure to thoroughly tidy and clean that second room. Maintaining a safe and secure environment is our top priority, so let's take a look at the guidelines we have in place for doing that. First, at no time shall a child in your care ever be left alone. Keep the floor free of clutter by periodically picking up toys and belongings. Do not allow children to stand on anything but the floor. Occasionally inspect the toys to be sure they do not pose a choking hazard. You may accept donated toys, but before allowing children to play with them, they must first be approved by the nursery coordinator and sanitized. Be sure to notify the nursery coordinator of any safety issues you happen to see, or if supplies are running low. Remember to put infants to sleep in the crib and on their backs. Back sleeping reduces the risk of sudden infant death syndrome. But also remember, children over the age of 2 are not allowed in the crib. Likewise, no child over age 1 may use the jumper or the bouncer. Children are allowed to use the Kids of the Kingdom playground, but 2 adults need to be with the children on the playground at all times. Should a child sustain a minor injury, such as a scrape, comfort the child first. Administer first aid. First aid kits are located in the cabinet above the sink. Use a cold compress from the kitchen if necessary. Remember to notify the parents at pickup time and complete an incident report to document the injury. The nursery is a well-child room, which means we cannot accept sick children. Children who have or develop the following symptoms must be removed from the nursery: a fever of 100.4 or higher within the last 24 hours, vomiting or diarrhea within the last 24 hours, skin rashes, a runny nose with green or yellow discharge, persistent coughing, conjunctivitis or pink eye, lice, ringworm, or other parasites, or any symptom that might be contagious. The rules for child pickup are few, but important. First, only adults may sign out a child from the nursery. That means that older children may not sign out their younger siblings. Parents must notify the nursery staff of changes in pickup prior to the pickup time. Now let's talk about policies for staffing the nursery appropriately. Every shift must have at least 2 staff members, and one of those staff must be at least 21 years old. The minimum age for working in the nursery is 15. As we discussed earlier in the training, all staff must submit to a background check and complete safe sanctuary training, and nursery must be CPR trained. Lord of Life will pay for the background check and CPR training. In terms of caretaker to child ratios, Lord of Life follows the regulations set by the state of Texas. There must be 2 staff members for up to 12 children under the age of 6. More than 6 children requires the use of a second room. Thus, there may be no more than 12 children in the care of the nursery at any given time. Other issues you may encounter are accommodating older children. You may do so as space permits, except on Sunday mornings when we limit the nursery to children aged 5 and under. Sometimes a parent is late in picking up a child. after 30 minutes beyond the scheduled pickup time, you will need to take the child to the parent or call the parent. You are almost done. Our last section covers closing procedures. First, tidy the room by putting away all the toys and supplies. Be sure to sort through the toy baskets to make sure that like toys are grouped together. Tidy the countertops and cabinets. Wipe down all surfaces in the nursery and the bathroom with a disinfecting wipe. Vacuum floors and rugs and mop if necessary. Sanitize all toys that have come into contact with bodily fluids. Gather all linens and blankets that need to be washed. And finally, turn off the lights in the nursery and the bathroom. That's it for the Nursery Policy and Procedure segment of the Safe Sanctuary training. Thank you. Your participation is greatly appreciated.